Whenever someone is a victim of a crime, the sooner that they can talk to someone about it, the sooner that they can start to heal, the better they are. The program's been around for about 25 years, and over the time we've evolved and expanded the types of patients we see. We see patients who report sexual assault, domestic violence, elder abuse, human trafficking, and child abuse. You can show lots of different emotions after you've been a victim of a crime. Sometimes what surprises people is that when patients come to us, they aren't having those emotions yet. So it might be that they're very brave and very strong at that point and they break down later.
Do you find that people oftentimes need to take breaks and they really do need to start to process what's happened?
Absolutely. The exam can be slowed down to whatever pace they need. During that time, it's about the patient, it's not about the forensic nurse. We set up the exam so that the patient has control of what's happening. If they need time for breaks, if they want family members with them, whatever it is they need to make a really difficult situation bearable, then that's what we do. When you've been a victim of a violent crime, your brain doesn't process things as it usually does. And so things that, explanations and instructions that you may be given usually, and you understand, when you've been a victim of violence, it takes more time to process. Our program sees over 2,300 patients a year. 50% of those are pediatric patients or children. In children, it's often that they don't report right away. They may not understand what's happened to them as being abuse or wrong or inappropriate. So with children, it could be a delayed disclosure. With adults, some come right away, and some it may be several days before they come. Sometimes they're in shock and not realizing what happened to them and where they need to go for help or what they should do next. So it really varies depending on the patient. The sooner they come forward, the more chance there is that we can collect evidence. In cases such as sexual assault or where biological evidence may be present, 5 days or 120 hours is the general rule that we use. It also allows us to look for any type of injuries that they might have before they've healed, and also the medical care, the medications that we can give them to prevent infection. The sooner they get it, the better they are. The good news is that with the advancement in forensic techniques, once I collect the evidence, it's preserved, and in some cases for many, many years. We have a nurse on duty 24/7. And during our busy hours, we actually have 2 or 3 nurses on duty. All of our nurses are registered nurses. Currently, there are only about 13 or 14 forensic programs in the state of Virginia. There's times when there's a challenge finding access to care, access to forensic nurses. And we use the term victim or patient here. Primarily we use the term patient. But in the advocacy circles, they use the term survivor because there absolutely is life after a crime.
Bon Secours Richmond is expanding its forensic nursing program to offer additional support and increase access to care, and the demands are there. To find out more, go to bsvaf.org/forensic nursing.